Today we will talk about the limb length discrepancy. Limb length discrepancy is a condition in which the paired lower limb of an individual are identically unequal in length. What are the causes? These are bone fracture, joint contracture, soft tissue shortening, ligament laxity, any kind of infection, degenerative changes. While measuring shortening, we have to follow the following steps. First, we have to see whether there is a shortening present or not. If it is present, whether it is true type or apparent type. If it is true type, where from it? Is it from hip or from the other part of the limb? Now move on to see the practical steps. We'll start the measurement of true length of the limb. Now patient is in supine lying position. Therapist stand on the tested side. Now we have to do the square of pelvis, means alignment of the pelvis. So first feel the pelvis and the ASIS of the affected side. We have to do the passive abduction and adduction movement if needed to make the ASIS of both sides, means the normal side and the affected side, in the same line. Now we have to measure the length from ASIS up to the medial malleolus of the affected side. For this, we will use a measuring tape which is in centimeter for better measurement. We will take the ASIS up to the medial malleolus. Now we can see it's about 86 centimeter in length. Now we have to measure the normal limb also for the comparison. We have to proceed the same procedure from ASIS up to the medial malleolus. We can see here it's 86 centimeter. So the true length is perfect. For measuring of the true length, when we are measuring the normal limb, we have to put it in the same position like the other one. Now we will measure the apparent length. For this, we have to take a point in the midline of the body. It could be the umbilicus or the xiphisternum. For this, we don't need the squaring of pelvis or the limbs. The limbs are not brought into the identical position also. Most of the therapists choose the umbilicus, so I am also choosing it. From the umbilicus up to the medial malleolus of the affected side. It's about 1 meter and 2 centimeter in length. Now we have to test the normal side also. From umbilicus to the medial malleolus of the normal side. It's again about. Patient is standing with feet 10 centimeter apart, knees extended and equal weight on both feet. The clinician places his hands on a bilateral anatomical structures, that is the ASIS and PSIS, on right and left side. Now the clinician visually assess if there is a length inequality, and if so, place a wooden board of 0.5 centimeter under the foot or shorter side. Keep placing thicker plank under the shorter side until equal length is reached. The thickness of the plank is equal to the leg length difference. Similarly, if the affected limb is longer, wooden blocks should insert under the feet on the normal side. till the pelvis is square. The height of wooden blocks indicates the true lengthening of the affected limb. Any true length of the limb has to be further examined to find out as to which segment of limb is shorted, whether it is the limb, whether the leg is short or the thigh is short or the shortening is above the trochanter. The last one is known as supratrochanteric shortening and is important in diagnosis of the hip diseases. For measurement, patient is in supine lying position, examiner stand on the tested side. The thumb of the examiner is placed over the ASIS of the affected limb. The middle finger placed on the greater trochanter of femur of the measuring part. Then the index finger is placed on a point where the perpendicular line from the ASIS and a line joining that line from the greater trochanter meets. It will form a triangle here which is known as Bryan's triangle. It will make an angle 90 degree on the meeting point of the line. If there any kind of decrease in this angle, we should it may be due to the coxa vara or the neck femur fracture of the affected part. With the hip in 90 degree of flexion, a line joining the ASIS and ischial tuberosity passes through the greater trochanter of that side. It's known as Nillerton's line. Patient in supine lying position. The hip joint in 90 degree of flexion. Now a line joining the ASIS and the ischial tuberosity should go through the greater trochanter of femur. If the greater trochanter of the femur is palpated well above the line, then it indicates the hip dislocation. With the patient lying supine, the line joining the tip of greater trochanter, the ASIS extended on towards the umbilicus from both the sides. Normally these lines meet in the midline above the umbilicus. If femur is displaced upward, the lines meet away from the midline. If both are displaced upward, the lines will meet below the umbilicus. Now we will do the telescopy test. It is the test for checking the stability of the hip. The patient in supine lying position with the affected side towards the examiner. Keep one hand to feel the greater trochanter and the ASIS, and then bend the hip and also the knee. The other hand placed just proximal to the knee joint. Now we have to do the piston like movement upwards and downward, upwards and downward. Along with this, we have to feel if the greater trochanter is moving or not. If it is moving, then the telescopy twist is positive. It means the hip joint is not stable. A positive telescopy means that the earlier head is out of the acetabulum or there is a fracture in the neck of the femur. That's all for the tests related to limb length discrepancy. Hope you all enjoyed it. Thank you.